demand for grants of the Ministry of Health and Family Welfare 2015-16. Firstly, I would like to quote as to what Minister has informed the Committee on Health and Family Welfare. It has stated that the projected demand of the Ministry for planned funds for 2015-16 was rupees 14.456 crore, but the actual allocation made is only rupees 6.254 crore. There is a shortfall of rupees 8.202 crore. The startling fact is that this shortfall in PAL allocation has been attributed to the non-allocation of funds for certain state schemes in the health sector. I urge the ministers to explain this huge gap in projection, allocation and non-allocation. There also has been cut at the revised estimate stage during the last year 2014-15 due to the 14th Finance Commission recommendation, which has increased the share of the state governments in central taxes from 32% to 42%. There is also confusion in regard to budgetary provisions for specific schemes like tertiary care health program. Though certain schemes would be subsumed in the National Health Mission, I would request the Honourable Minister to specifically state the budgetary allocation for various segments in National Health Mission for 2015-16. The budgetary allocation has been drastically reduced for 2015-16 in National Health Mission from more than 20,000 crore to less than 19,000 crore. Over the years, the general refrain of the Minister for underutilization of budgeted fund is that 75% of the money goes to the states and the onus is on the states to spend that money. Here I would strongly urge the Minister to ensure a mechanism in place which should pave way for spending by state right from allocation, that is in the beginning of the year and at regular intervals, show that underutilization of funds or overutilization of funds in the flag end of the year of delay in furnishing of utilization certification by states will not arise. There are certain schemes for which nil or negligible allocation has been made, but these schemes are critical for addressing the imbalance in health care and must be protected from budgetary cuts. Sir, I will mention some of the schemes. Trauma care, capacity building for developing trauma care facilities in government hospitals or national highways, budgetary estimate nil. Burn injuries, budgetary estimate nil. National Tobacco Control Program, budgetary estimate nil. National Mental Health Program, budgetary estimate nil. National Program for Prevention of Control of Cancer, Diabetes, Cardiovascular Disease and Stroke, budgetary estimation nil. Healthcare for elderly, budgetary estimation nil. National Program for Control of Blindness, national budgetary estimation nil. Human Resource for Health nil. Telemedicine nil. Sir, National Tobacco Control Program, the budgetary allocation was rupees 40 crore, but it has been reduced to 20 crores at revised state. But the department has been able to spend only rupees 1.40 crore. On one hand, an estimated 1 million Indians die annually from tobacco-related diseases, and on the other hand, the department has only able to spend a meager amount of the funds. National Program for Health Care of the Elderly, budgetary allocation was rupees 50.83 crore. Revised estimate reduced drastically to rupees 25.50 crore. But the misery is that utilization figure amounts rupees 21.47 crore. Sir, West Bengal is a dead state, but under the leadership of our Chief Minister Mamata Banerjee has been doing great service in the health scenario. I would like to just name a few services provided to the people of West Bengal. In West Bengal, Cancer patients are provided with free treatment. Even hospital beds are provided free of cost. West Bengal has over 66 neonatal care units, which is providing excellent service to the people of West Bengal. Another major initiative of the West Bengal government is setting up of fair price medicine shops at district level hospitals, subdivision hospitals at subsidized and concessional rates. Patients have to pay only 40% of the price of the medicine from these fair price medicine shops. 98 fair price medicine shop. Said dialysis center, MRI, USG are set up at the district hospital, subdivision hospital of the West Bengal. With limited resources, West Bengal government has been performing excellently. The center has to provide more funds to the states so that states could take more care of the medical needs of the people of the West Bengal. Over the years, the general refine said now is the time to take preventive and stern measures by pay more attention and more allocations and save the people for falling prey to acute health problems. It is an astonishing fact that poor and deprived people of our country have always been the victims of all types of diseases. To just quote a few examples, India is the second when it comes to diabetes. We also have the dubious distinction of having the maximum death due to cardiovascular diseases. We also face the problem of non-availability of doctors in rural areas. Our primary health centers lack not only doctors but also basic medical facilities. Sometime back, 50 children below the aged group of 40 in Bihar lost their lives to a mysterious disease. According to the National Institute of Virology, deaths occurred due to an uncommon or a new virus that was the cause of concern in Muzaffarpur, Bihar. We have such incidents happening every now and then. I would urge the minister to look into the aspect seriously. The center has to provide more funds to the states so that states could take more care of the medical care of the people of the states. Another cause for concern is the mental health of the people. Mental health disorders are becoming too huge to be tackled under the existing health services available in the country. Always the victims are poor and those who cannot afford the basic medical facilities. Female feticide has become rampant with the decline in the child sex ratio. This needs to be stopped lock, stock and barrel. It is important to quote the WHO UNICEF 2012 report here. Countdown to 2015 on maternal, newborn and child survival, wherein it is stated that poor maternal nutrition would result in at least 20% of the maternal death. And malnutrition is, sir, 2 minutes, please. And malnutrition is one of the major underlying cause of infant mortality in India. And 1/3 of the child deaths in India are attributed to undernutrition. I would also request the minister to respond on maternal death. In spite of the claims of the government, child mortality is on the rise. And what measures have been initiated by the government in the last 11 months to ensure that under 5 children lead a healthy life so that their growth is unhindered by any ailment as they move ahead in life. How much funds have been allocated by the ministry to address the serious method of child mortality? It is a matter of utter disbelief that the spending on health as a percentage of GDP is 1.1%, whereas it is in China 3%, USA 8.3%. This is the figure of the 2013-14. It is envisaged to increase it to 1.87% by the end of the 12th plan. This would not help to tide over valid problems of health. Hence, I would strongly beseech the government to increase the spending on the health to at least 5%. Otherwise, the dismal picture of the health scenario in the country, which is existing, would aggravate and take the turn for worse epidemic for, and I'm concluding, sir. And it would become highly impossible for the government to arrest or mitigate the sufferings of the people who are facing infant mortality, maternal mortality, female feticide, diabetics, cancer, heart disease, hypertension, kidney ailments, and what not. Thank